in order for this horse to function properly. That's very important to remember, because we see all the time, we'll get called on these horses that are short-strided in the right rear, or they're short-strided in the left rear. And we just can't find a problem, doctor. So my question then is, well, what's going on in the opposite end of the horse? How's the front end of the horse move? Oh, the front end's perfect. Your horse walks in a circle? What? If the front end of the horse is moving perfectly, okay, so that means 2 full strides every time the front end of the horse moves, but the back end of the horse is short-strided, okay, the back end of the horse won't go as far as the front end of the horse, and we end up with a horse that walks in the circle. Usually what happens is we have a compensatory gait problem. We end up with a horse that's short-strided in both front legs. Now, let's talk a little bit about the short stride. What is a short stride? Short strides can be very easy to pick up. I'm short striding in my right rear. Very obvious, because we're used to comparing one side of the horse to the other side of the horse. Okay? We see a lot of horses that are bilaterally short strided. They short stride in both legs. How can we tell that? As this leg moves forward, okay, in the swing part of the phase, of the walk, the last part of this swing phase is hyperextension. It locks this joint, this joint, this joint. Allows the foot to hit heel first, and decreases degenerative joint forces that occur all along this leg. There's many anatomical structures built into this leg that decrease these joint forces and allow the horse to move efficiently. The ligaments allow kinetic energy of downward movement to be stored as potential energy and then changed into kinetic energy when the horse breaks over. Okay? So when the horse moves forward, there, okay, so we're storing, move forward just a little bit. And there, as that horse is getting ready to break over right there, that energy, okay, is converted. If these ligaments are lax and they're not, so if this foot goes to ground right there, these ligaments aren't extended, they're not able to convert that energy. Okay? Plus, if we all hyperextend our finger and walk, okay, versus not hyperextending our finger and walk, we can feel some degenerative joint things going on in these first 3 joints. Sometimes people can even feel it all the way up into their wrist. So, we have the ligaments, we have the frog, we have underneath the frog, we have the digital cushion. Okay? These are shock absorbers. They are supposed to hit the ground on every step. If this horse hits toe first, or is wearing some sort of apparatus on his foot that doesn't allow the frog and digital cushion to work, then we have increased degenerative joint factors taking place in this whole leg. That's why it's so important that this leg stretch all the way out every time. Okay? We can see that when we watch our horses walk. Here's an example of a horse that when we look at these pictures here, the one picture you can see where the horse is fully extending his legs before it hits the ground in the one picture, and in the opposite picture it's the same horse. We have artificially caused him to have a short stride, and you can see where the foot is not fully extended just before it goes to ground. Okay? So anything that would cause this leg to not fully extend is going to affect our biomechanics. What can do that? Wow. A problem in the jaw can cause tightening of these muscles of the neck, which will cause a restriction in movement of the shoulder. We have a big muscle right here that controls how this scapula rotates on the chest wall. Anything that touches this muscle or causes that muscle to tighten will cause a limited rotation here. A bad fitting saddle. Okay? If a sore neck can cause that. Anything, the short stride. We do not want a short stride in our front end because that will cause a short stride in our back end. Now, let's see if this horse can move throughout the thoracic spine. So we ask her to tuck. You can see she has some restricted motion. She doesn't want to tuck on there, but she does move a little bit. She should bounce because we need to remember that energy is generated back here. This is like the drive shaft of your car. Energy has to come from here and go forward. Okay? Okay. Now, if we turn her sideways, there we go. As she moves away, this rib cage will tighten and will push the abdominal organs away. That allows this back leg room to move forward. Okay? We don't have to do that when we move. Okay? My rib cage doesn't have to move to the side so my leg can move forward. Hers do. Okay? So if she has a sore rib, if she has a girth that's bothering her, all that's going to affect, if she has a stomach ulcer, that's going to affect the way her rib cage moves. Now, if we look at the spine here, we'll see that the area of the thoracic spine really has no lateral flexion. Okay? The ribs kind of prevent that. So if we watch this spine move underneath our hands with the rib cage, we can see that we don't have lateral motion. But the rib cage does move as a whole. It moves side to side. It moves as a whole. Okay? So we do have that type of motion here. And as we come back, we should have more bounce. Move her just a little bit. Move sideways again. We have more bounce in our lumbar spine, just as it connects to the pelvis.